Welcome back. In this series of videos, we're going to be going over sexuality, introduction to the concept of sexuality, what it means, and going over different STIs, sexually transmitted infections, or you might have heard the older term sexually transmitted diseases or STDs, but these days we call it STIs. So we'll get into it. So the concept definition, how we define it at Santa Fe College, sexuality is one of our core concepts in our curriculum. And so, yeah, we define the concept as sexuality is an essential part of being human across the lifespan, which encompasses identities and roles, sexual orientation, intimacy, and reproduction, right? So when we talk about sexuality as a concept, this is what we're referring to. And so a lot of different aspects of our curriculum and parts of the nursing program kind of fall into this. So again, a lot of what we're talking about in this series is STIs, but your maternal infant course is going to have a lot of content related to sexuality for which should probably be obvious reasons. But they'll be a little bit sprinkled out throughout your med surg courses as well. And so I always ask students to take a moment and just on your own define these terms. If we were in a group setting, if we were in person, I'd say take a moment, define these terms on your own, if you as best you can, and then turn to a partner, share them, and then we'd kind of discuss it as a class. So yeah, if you want, pause the video, do that now if you can, or you don't have to, but I think it's useful. Um, and so yeah, so like I said, usually we kind of share these definitions amongst each other and kind of discuss them. There's not really, everybody probably has slightly different variations on some of these definitions. So I'm by no means the authority. If you ask 100 people how they would define these things, you'd probably get 100 different answers. But when we talk about sex, first off, one way you could define it is just the act of having sex, right? Two people having sex, engaging in like sexual congress or activity. Another way you could identify it is as biological sex. So usually in the course of, talking about human sexuality and sexes, we usually refer to people as male or female. And more often than not, that's defined by the external genitalia we present with. Um, Sometimes people might say, well, that refers to the chromosomal makeup of the individual, right? So, if you have an XY or an XX, so men have an XY, women have an XX. I always explain to students, though, that there's a lot of ways to even understand sex, and even those kind of common ways that we think of sex, at least in terms of differentiating between the sexes, they're not exactly accurate. They're good for a very quick overview, right? If we're talking about the vast majority of cases, it works very well. But even when we talk about the idea of quote unquote biological sex, the kind of like binary we have between male and female, it doesn't always capture all the complexities of human biology. So, for example, there are individuals that have sex organs of both male and or sex organs that we would usually ascribe to males, and also the sex organs of someone we would usually ascribe to females. So there are individuals that are born what we call intersex, meaning that their biological sexual differentiation doesn't kind of track onto either the male or the female or some kind of combination of those. There are individuals who have XXY chromosomes. There are people that have XX chromosomes, but they have potentially like a penis. There are people with XY chromosomes that don't, and yeah, there's all kinds of different um, specific kind of like intersex. I don't want to say disorders necessarily, but just abnormalities. And again, not a judgment saying abnormalities, just that they don't track onto like kind of the usual way we think of sex being male or female, right? So again, the way we kind of use male and female to differentiate between biological sex, it works in most cases. And so I think that's why it's so common to hear it kind of referred to as that way. But it's still not 100% accurate. Like the way the way to really truly understand human biology doesn't quite work. That being said, we don't need to get PhDs in, human sexual biology. We're nurses, so we just need to be able to understand these concepts on a macro level, so we can treat our patients. But I'm just putting it out there to make sure people understand that, yeah, it's not quite as cut and dry as sometimes we think it is, or we sometimes act like it is just in our kind of day-to-day lives. And then, yeah, gender. So again, lots of different definitions for this, but usually when we talk about gender, we talk about masculine or feminine. Some people might also say, well, there's male and female sexuality or sex, and then there's male and female gender, right? You might say they're one and the same, but usually what we have a discussion on is the idea that gender is a social construct that is oftentimes associated with one or the other uh, sex. So, masculinity in the case of men, femininity in the case of females. And what that actually means, what constitutes masculinity or femininity, it really varies depending on time and place, culture, religion, socioeconomics. All these things kind of conflate to create our ideas of these things, right? And they vary even within a culture, within a time frame, within a group of people. Like I said, if you're in class and we discuss this, 100 people in the room, they'd all have different ideas of what they might ascribe to masculine versus feminine because we have all kinds of different students of different, ethnicities, backgrounds, etc. And again, these things change over time. So just as an example, in the US 100 years ago, it would be very uncommon for women to attend college. Just as, so in terms of the demographics, it was very uncommon. And it was seen as something that only men did. And now, actually, if you look at data, I believe, at least at the time of this recording, which is July 2025. So whenever you're watching this, might change again. But as of this time, the um, the opposite is actually occurring, where now I believe it's the case that more women attend college than men, in the U.S. at least, and so that's a huge change, right? But yeah, again, it just kind of goes to show, I think, like the way we view gender, it changes, right? Even something like, I'm a male, I'm a nurse, I'm a teacher. 100 years ago, being a teacher, being a nurse, were not something that people associated with men. And maybe some of y'all still don't associate it with those things, but here I am, and here's a lot of other male nurses and male teachers and male nursing teachers. So these things change. And then the last thing, sexual orientation. Again, different definitions people give, but usually this is what we talk about when we mean um, how someone expresses themselves sexually, what they are attracted to sexually, who they want to partner with and have a sexual relationship with. And so, kind of the common, yeah, descriptions you'll hear: homosexual, which means sexual attraction to members of the same sex; heterosexual, meaning you're sexually attracted to members of the opposite sex; and then bisexual, meaning you're attracted to members of both sexes. Um, so I kind of went over this before, but yeah, there's different views about sex, relationships, gender, the roles we inhabit across different families, cultures, religions. I usually ask students what are some common tropes regarding sexuality for women versus for men. We talk about those. So again, I'd say pause, and maybe if you're alone, you can think about those things, or if you're with people, you could discuss them and just think like, yeah, what are some of the common tropes? Or do they bear out? Again, just stating these tropes doesn't mean you necessarily agree with them, but that's what we have in our culture, right? And so it's worth discussing and again highlighting the fact that these things change. And the reason it's important for us is because as nurses, we take care of people across different ages, different cultural backgrounds, different ethnicities, different sexes, different sexual orientations, different genders that are in all kinds of different relationship patterns that are of all kinds of different religions. And so it's really important that we, come in with the sensitivity needed to treat anybody we might come in contact with the proper amount of respect and empathy, for the situation they're in. So the one example I like to give is just the difference that we have in terms of what's called female circumcision and male circumcision. So usually in the U.S., female circumcision, we don't even call it female circumcision. We call it female genital mutilation. And I would personally describe it as that as well. So I don't want anybody to get it twisted and say I'm saying they're the same or something. I'm not. But in other cultures around the world, female circumcision is something that is regularly practiced, and it's not seen as what we would see, what I think most people in the U.S. see it as, or at least I do. I don't want to speak for everybody, but I see it as a form of genital mutilation, where it's actually mutilating a woman's genitals. But in other places, it is not seen that way. And conversely, here in the U.S., again, at least at the time of this recording, it's still very common for boys when they are born to be circumcised. Male circumcision is still very common, but again, in other parts of the world, that would actually be seen as genital mutilation. And then in some places, both of these things would be considered genital mutilation. So, um, it's just understanding the differences in places. And so, as a nurse, you might interact with individuals who, and especially if you work in a setting where you're having to do sexual health histories, or you work in like a urology floor or clinic or something, you're dealing with people's sex organs, at least tangentially, because the urine comes out of either the same organ or pretty close by. You might encounter people that have undergone female or male genital mutilation or or circumcision, and you might experience people that haven't done either, even though maybe your experience is only seeing, circumcised men, but you might take care of men that aren't circumcised, and same thing for women. You might, encounter women that have had female circumcision done to them, and so it's important to just understand, these are things we might encounter as nurses, and we have to have the right sensitivity to these things and respect for our patients and their beliefs. And again, our primary goal is to be an advocate for our patients and their health. And so I already mentioned, yeah, sexual orientations. Um, these are kind of the main ones: homosexual, meaning you're attracted to members of the same sex; heterosexual, meaning you're attracted to members of the opposite sex; and bisexual, meaning you're attracted to both. And so, yeah, another thing to get into is LGBTQ issues in healthcare. So LGBTQ, just probably most people know this, but it stands for lesbian, gay, bisexual, transgender, and queer. Um, I always joke around that in this lecture, if anybody has the desire to get me fired, this is the time to do it because we're talking about, sex and sexuality. So it's very easy for somebody to find something they take issue with when we're talking about these things. Um, but yeah, so just some LGBTQ issues in healthcare that we face and have to deal with. So one, there are individuals, as I mentioned before at the start, they're referred to as intersex. These are individuals that are born with a sex that's either ambiguous or there's maybe a presence of both male or female sex organs. There are some chromosomal differences that don't fall in line with the normal XX or XY patterns. And so these individuals often face a lot of challenges in healthcare. Not always, but they can. Um, I think our understanding of these issues has come a long way, at least in my lifetime. But it's not uncommon to have had people born, 50 years ago or something, where they might have had an ambiguous genitalia presenting, and it was actually the physician and the medical team in collaboration with the parents, would kind of make a decision as to what sex the baby should be. And so they might have been born with both a penis and a vagina, or, a penis and ovaries or something, and they um, do some modifications to try to remove one or the other sex organ. Um, but as the child develops and gets older and goes through puberty, they actually identify with the opposite sex, the one that they weren't kind of raised as. And some people are raised just as intersex. They have both and they're not changed. Or they go through puberty the way they just naturally would, and they kind of discover those things on their own. Some people don't even know that they have these issues until maybe they're later in life. There are people walking around now who, identify as male or female, who actually are intersex and just are never aware of it. I couldn't tell you the exact number, but there are plenty of people who find these things out later in life after they've, you know, been an adult, maybe even had a family. And it's because, yeah, we don't usually do chromosomal testing on, people just like a matter of course. Most people don't know their chromosomes. I mean, you could probably guess, for most of us, but for a couple of us, out there, it's probably not what we think it is. And so, yeah, sometimes there's issues where these people maybe had a sex that was kind of assigned to them, but it's not the sex that they started to experience their body changing into as they got older, or that they really identified with as they got older. So it's kind of complex, but again, yeah, if you work in like a sexual health clinic or something like that, you might, interact with patients like this or who have some of these different intersex yeah, patterns. And then there are transgender individuals. So transgender individuals are people who are born with the chromosomal or external anatomy of like one sex. However, their gender identity does not align with that. And so it's different than being intersex, right? So I want to point that out. Intersex and transgender individuals, they're not the same. Some people who are intersex or transgender might kind of um, claim that yeah, like I'm trans or whatever. They might call themselves that, but not every single one, right? And so, in the same way that not all people who maybe identify as gay would say that they're trans, it's a similar thing, right? Some gay people might say, yeah, I'm trans, but they might not. A lot of these things are very personal for people. So, yeah, I'm just pointing out that just because someone is intersex doesn't mean they're transgender. Just because someone's transgender does not mean they're intersex. Um, Transgender individuals, like I said, they're born with the physical or chromosomal characteristics of one sex. However, they view themselves as the opposite, or that they have a gender identity that does not kind of match up socially with their sexual anatomy. And so this can lead to what's called dysphoria, which is feelings of unease, anxiety, disaffection, that's kind of caused by this incongruity between how they view themselves and what their external genitalia and their maybe chromosomal pattern shows. And yeah, there's a lot of debate about these issues around the world, in the US currently, and probably when you're watching this, I don't know. But there are questions about, if someone identifies as transgender, when or is it safe for them to undergo sexual affirmation therapies, so like hormone replacement or even surgeries. A lot of this question stems from the fact that if someone is transgender, and they go through puberty as, one sex, but they don't identify as that sex. Um, it's very hard, or don't want to say it's hard necessarily, but it's more of a challenge to undergo what we call like transitioning after you've gone through puberty, because again, a lot of your secondary sex characteristics have started to manifest, versus if you start to undergo that process prior to puberty, it kind of I don't want to say it has better outcomes, but it just I think a lot of times it goes a little bit easier for the individual, at least in terms of their just the physical and mental toll and emotional toll it kind of takes on them. Having said that, it's also true that prior to puberty, most children don't really have a good sense of who they are. I would even say as a right now 40-year-old man, I don't necessarily know that I have a great sense of who I am all the time. But yeah, people they say that human brains don't really fully stop developing until about the mid 20s. And so even when somebody's an 18-year-old and we say, oh, you're an adult, you can vote, you can buy cigarettes, you can get drafted and fight in a war, you're still not actually fully developed and you might change some of your ideas about who you are, what you are. So yeah, I say all that to say, yeah, it can be the case that some individuals might worry that yeah, if this process happens too soon, children might end up making decisions that have longer term implications that they don't actually agree with long term, but they just feel right in the moment. So, I and you are not going to solve these issues immediately, but I'm just pointing these things out. And so as we take care of people that are, um, transgender, experiencing these feelings. We need to be open, understanding, try to, yeah, work with them as best we can, be respectful for them and the issues they're dealing with. It's also true that, people who are lesbian, gay, bisexual, queer, other kind of identities in that subgroup or that group, whatever you want to call it, experience disparities in healthcare, and disparities in the level of care they receive, disparities in the types of health problems they have. And so I usually ask students to kind of think about these things, but just a few off the top to talk about. Um, you know, Traditionally, homosexual men have a much higher incidence of sexually transmitted infections like HIV, as well as some others. And we're going to talk about that more when we talk about HIV. But a big part of that is just because of the mechanism of transmission and how it works. It has nothing to do with anything they're doing that's wrong or something. It's just the way that the mechanism of how the virus transmits. A lot of LGBTQ individuals suffer higher rates of depression, homelessness. Um, yeah, they sometimes feel distrustful of healthcare providers, especially if they're not respectful of them. They might have questions or concerns about coming forward with um, their own sexuality because they're afraid of being judged and things. And so yeah, nursing can contribute to that, both positively or negatively, right? As nurses, if we are respectful and we try to, embrace our patients with open arms and have a non-judgmental approach and are respectful, empathetic, we can create a much better patient nurse relationship that can lead to better health outcomes from them. If we don't do that, it can mean that a lot of things don't get addressed, that a lot of questions about maybe their sexual health doesn't get addressed. Um, so anyway, I mean, I'd just say encourage everybody to treat other patients, respectfully and everything. When another example I can give is a lot of people maybe don't realize because a lot of people now were very young when this happened, but I said I'm 40 as of the time of this video. Gay marriage was only legalized in the span of my lifetime, and probably in anyone who's watching this video, probably in the span of your lifetime as well. Um, it's only been in the last 20 years, really less, that gay marriage has been legalized. So you have situations where people who were in homosexual relationships, if they had a loved one, for example, who was dying, or they were in, a healthcare facility, and um, they had their partner come, sometimes their partner couldn't come back and see them in different institutions. They couldn't have durable power of attorneys and make healthcare decisions for them if they were in a position where they couldn't. And just a lot of issues like that, right? Which kind of meant that people who were in love and who, had a domestic partnership with each other couldn't have the same kind of rights to healthcare and control over what their health desires were as somebody who was in a more traditional like heterosexual relationship. And so again, that's been a that's not ancient history, right? That's in my lifetime, and I think there are still remnants of that, and depending on circumstances, depending on the place and time. So it's just something to be aware of as a healthcare provider. And then I'm teaching at Santa Fe College. I'm in Florida. There was a Florida Senate bill that was passed a little while ago. That was basically it's called Protections of Medical Conscience, stating that healthcare providers can refuse to provide treatment to patients based off of their ethical beliefs. And I would just say, for me personally, my hope would be that none of you watching this would ever have to exercise that. And the reason I say that is because as nurses, like a big part of I firmly believe a big part of our profession is being empathetic to individuals, and helping them with the problems they have in terms of their health. So it doesn't mean that we agree with everything they do. It doesn't mean that we um, you know, are applauding their lifestyle, whether that be their sexuality, their political thoughts, their, philosophical ideologies, their, religion, whatever. It's not saying that we necessarily agree with all that. It's saying that as a nurse, you're kind of given this task of yeah, promoting the public health and specifically the health of our patients. And so if we refuse to do that, I think it kind of undermines the profession as a whole. And I think it can have real issues and real consequences for how our profession is perceived. Like we have a lot of trust from people in the US and around the world as nurses. Nursing is consistently rated as the most ethical profession by Gallup polling, which is a national polling firm, and they do, polling on all kinds of things. But every year since the poll has been done about, what profession do you see as being the most ethical, nursing has been number one. And so whether you agree that that's the case, whether you agree that we're more ethical than other people, I certainly don't think I am. I'm probably the least ethical person I know. I'll let y'all leave it up to your imagination to tell if I'm being serious or joking. But yeah, the reality is that that's how we're perceived, right? And I think that these things can sometimes, yeah, if we start to judge our patients or refuse to provide care to them, I think it has some really negative implications for our profession. And I would just say that as a nurse, and this is in no way comparing, LGBTQ individuals to, some of these other groups I'm going to be talking about, but as a nurse, we're asked to take care of a lot of different kinds of people. Some of you, if you're watching this and you've been through clinical some already, you will have already probably taken care of prisoners. You'll have taken care of people that are different race than you, different religions, who have different, yeah, sexuality, that some maybe you're trans. Um, some maybe have very different politics from you. I know it's kind of a funny thing that when we teach students how to assess for a patient's level of orientation. One of the common questions we ask is, "Who's the president?" Because that's kind of it's very easy to tell if somebody's confused or not if they can tell you it's one of the things that can give you good indication if somebody's confused or not. And increasingly, I've heard a lot of students say like, I've stopped asking that when I ask them like what year it is or something instead, because if I ask them that, they start going off on a political diatribe, and whether I agree with them or not, it's like I'm there to do an assessment. And yeah, I understand that. A lot of people have different politics, and in all those cases, right? In all of those cases, it would be, I think, very damaging and disruptive to our profession and to the world if, I started to say, you know what, this person has different politics than me, and I think their politics are evil and unethical, and so I don't think I should take care of them. Or this person's religion I feel is unethical and it's evil and whatever, and therefore I'm not going to take care of them. Or this person did some horrible things in their life, so I'm not going to take care of them. I think it creates a situation that, yeah, it's very damaging for our credibility as healthcare providers. And so that's not to say that you have to violate your own ethics to provide care. I'm not saying that. But I would just say that, if you are worried about maybe taking care of somebody who identifies in a different way, or just as another example, we're not talking about this today, but I know the question of abortion and providing abortions is like yeah, it's a real question for a lot of people, and there's a lot of ethical ramifications with that. I would just say that if you're someone who has a lot of like, yeah, you don't believe that abortion is ethical and it's wrong, and you would never want to, you know, carry out an abortion on somebody because you see it as wrong. I would say that, yeah, that's totally reasonable, I think. But yeah, you'd want to be very careful that you're not working in a facility that deals with a lot of infant and maternal health. And I don't say that to say that you can't, but it's more to say that, um, those kind of abortion is sometimes a medical procedure, and it's done for individuals who are not necessarily even looking to terminate the pregnancy, but it is needs to be done either to protect the mother, or in some cases because the fetus is not actually viable. It's actually dead, or there's ectopic pregnancy. There's all kinds of again, you'll learn all about this in maternal infant, but when we talk about um, maternal infant health, and we talk about their gravid status, basically like how many pregnancies they've had, we call any like termination of a pregnancy, whether it was done by spontaneously or by like medical providers, an abortion. And that's because, yeah, it's unfortunately a large part of maternal infant health is sometimes fetuses not being carried to term for no reason other than just that, like, yeah, the baby just couldn't, the fetus just couldn't survive. Um, people miscarriages, and we refer to those as abortions, at least in terms of how we document them and stuff, and people's like health history and things. Um, so anyway, it's just saying like, if you are aware, it's good to be self-aware. It's good to acknowledge like I have feelings about this, and so yeah, it's not a good setting for me to work in. I myself can say I've never worked in psych nursing because I find psychology extremely fascinating, but having done clinical rotations there in my nursing school, I realized like I don't think this is a good fit for me. Um, just no reason. I don't think anything bad of like psych patients. It's just like the setting. It was not my cup of tea. It wasn't the kind of work that I would want to do. I like working with my hands, right, and putting in IVs and stuff, and it wasn't for me. And also, I think there's a lot of challenges in terms of how you communicate with patients in the psych setting. You can't communicate with them sometimes in the same way that you would with patients outside of a psych setting. So I know I went off on kind of a long diatribe and got on a bit of a soapbox here, but I think it's important because, as I said, this is it's an issue that goes beyond the scope of just like sexuality and sexual health. I think it gets to like the root of our profession and what our mission is, and it's to, yeah, try to care for people. And again, we're not here to judge people. We're here to try to do the best that we can to provide for their health. And again, that doesn't mean that we have to violate our own ethical beliefs in doing it, but that again, as a nurse, you're going to take care of people that, um, yeah, they're they're going to be very sick with diseases, and you're going to be doing everything you can to help them, and they're going to be mad at you, and they're going to blame you for the fact that they're sick. And I'm not saying that you have to succumb or endure any kind of abuse or harassment. I'm not saying that, but I am saying that um, sometimes you can't let people's views of you get in the way of doing what's best for them, right? Like that empathy means sometimes, or every time I would say, is taking care of people that and being nice to people that aren't nice to you. It's very empathetic. It's very easy to be empathetic to people that are your friends or loved ones or people you like, but I don't really think that's empathy then because you like them. Empathy means you're doing stuff for people you don't really agree with or you don't really like. And so, again, get off my soapbox now, but I just think that's really important. And yeah, hopefully something that y'all will all carry with you. And then in the next video, yeah, we're going to start talking about actually doing our sexual health histories and assessments.